Everybody, we're going to call the meeting to order for the Health, Mental Health, and Education Committee. It's 9:05 and we're in 1010. Thank you to my colleagues, Councilmember Mitchell Farrell, Joe Buscaino, and I believe Mitch Englander is here as well. We have a quorum, so I'd like to call this meeting to order. I'd like to remind those who haven't signed, who would like to speak, fill out a speaker card and bring it up to the front. At this point, we're going to open to public comment. And we have one. It's Herman. Yeah, general public comment. It's Herman, okay. Mr. Herman?
54954.
1 minute, 1 minute.
B. Letting you know that the Brown Act protects me from signing that card. Be aware of that. And I hate to say this, but your yellow belly need to do something about the homeless. Mental health, conditions for people with AIDS, people who suffer with AIDS, people who come to work with AIDS. Every motherfucker needs help. Do something about it. We're sick and tired of seeing the homeless, mentally challenged, disabled on our streets because you have over $100 million fucking dollars to put towards the homeless people who suffer mental aging. Don't you fucking get it? I guess not, huh? That's why John Walsh says you fucking yellow belly should do something about it. It's fucking right. All fucking day I see people on the street. All fucking night I think of the homeless people on the street. And not one fucking thing. And if that's how you want to hear it, it's going to be a fucking long day for LA today because I'm fucking fed up with the homeless people on our streets, our veterans, our Americans.
Thank you for your colorful commentary. Seeing there's no more cards, general public comment has now been heard. I'd like to move to agenda item number 1. Mr. CLA, would you please read in item 1?
Item number 1 is motion Rue Koretz directing the Los Angeles Department of Aging to report on current initiatives and programs in use and plans in motion to better integrate city services with the nonprofit service sector, the County of Los Angeles, and the State of California to better address current and future challenges of the city's older population.
Thank you, and I believe the general manager is here. Trejo? The floor is yours.
Thank you.
You give us colleagues, this is when we first for our first meeting I did mention that I wanted to bring our general managers for the various departments that are under this committee to give us an update on their departments, what they're working on, and maybe we could do it on a periodic basis.
Yes.
But go ahead.
I have a lot of slides. I'm not going to go into detail on all of it, so I'll let you know that in advance. Laura Trejo, General Manager of the Department of Aging, and I'm joined by my esteemed colleague, James Don, who is our Assistant General Manager today, serving as Vanna. Wanted to share with you a little bit of the background of the Department of Aging, just to familiarize you with our structure and some of our services and some of the partnerships and collaboratives that we're engaged in. Next slide, please. The Department of Aging's mission is fairly straightforward. We're here to make sure that the quality of life of older people in our community is maintained, that we really advocate on behalf of their independence, their health, and their dignity. We have 3 major core functions that we distill our work around. Advocacy, meaning that we raise issues when they are of concern to seniors or their family caregivers, or we make sure we inform older adults to be the best voice for themselves, as well as their families. We also have a mandate to be strategic planners. We do a lot of work around trying to evaluate the changing needs, the emerging trends, as the population expands. So that is also one of our main functions. We also have a function of helping to develop the system of care that will serve older adults best in the community. That is not only limited to our system of care that we help to finance, but also to look at other systems of care. Most of the care received by older adults is not provided through the Department of Aging. It's provided through the healthcare system, mental health system, social service systems, and others in the community. So it's also our role to be technical support and advisors and advocates to those systems to make sure that they are addressing the unique needs of older adults. Next. Our role in the community is fairly multidimensional. We assess community needs, as I mentioned. We develop and fund programs. We educate and provide direct assistance. Most of our work in terms of direct services is provided through partnerships with neighborhood level, mission-driven, community-based nonprofits. Our system serves as a portal of care. Many older adults, when they don't know where to go for help, come through us, and we help to link them to the appropriate services that they need. We're also custodians of the public trust. We utilize public funds, and we work to try to make sure that those serve as many people as possible. One of our tasks is also, as we're creating the system, is to make sure that we have a robust provider network, that we monitor the quality of services and ensure their continuity on a long-term basis. Next. Under the Older Americans Act, which is the primary enabling language that designates us as a federally designated area agency on aging, we are required to develop a 4-year strategic plan. We're actually in the process right now of creating the one for 2016 to 2020. That's a very unique piece of legislation in terms of the Older Americans Act, because it actually anticipated that the tremendous shifts in the population would occur in such short periods of time that you could not have an area agency that operated without a strategic plan and that was not going constantly into the community to find out what those changes meant. So we're constantly trying to reevaluate that if what we're doing still works. If it doesn't, how do we adjust it? Older Americans Act and Older Californians Act basically direct about 63% of our funding. As you can see, currently we have 4 area plan goals. Like I said, those are currently being evaluated to see if they're still meaningful to us moving forward. If they're not, we're going to be tweaking them or completely changing them according to the needs of our community. Next. We are required by law to have an advisory council on aging. That advisory council is, again, very unique in its constitution. It's 50% have to be older persons over the age of 60. They actually have to sign off on the area plan, which releases the federal and state dollars. For a community-based advisory group, that's a very, I think, meaningful role for them to have. We currently have, our council has about 25 members that represent the diverse community of seniors in Los Angeles. Mayor and city council are honorary members, and you are always welcome to join us.
How often they meet?
They meet monthly. Yes. Next. Our target population. Next, please. Next one, James. It's not moving. Okay. Defining older or older adult can be a very tricky situation, so I gave you some examples. The process of aging is very dynamic and very unique. As we get older, we become more unique compared to everybody else the same age. So it's one of the challenges of working with seniors is that the older they are, the more unique they become. Most of the time we refer to aging as chronological aging. You're 50, you're 60. You know, AARP considers you older at 50, Medicare at 65. So there's a tremendous difference. 15 years is a big difference if you think about in anyone's life. But we could also look at biological aging, how people are experiencing medical conditions and other challenges to their bodies. We are all living longer. That's one of the best parts of this time frame. And we are seeing tremendous gains in life expectancy. One of the areas we focus a great deal on is the functional aging. And that's because 2 people with the same medical condition could present very differently. One being very, doing well, very independent, another one being very frail and needing lots of support. Yet the diagnosis is the same. So for us, functionality becomes an important factor that we evaluate too. As I said, there's a variety of ways of defining aging. The jury's still out. It's a work in progress for us to decide what is older adult going to be. Next. We serve a variety of populations, and I put this one up there as a way of reminding ourselves. We are charged and tasked to develop programs for about 40 years of our lifespan. That is a lot of years to try to tailor programs uniquely to serve the needs of folks. So, not perfect, but it's a way of trying to define them. You see, young adults are still people who work. They have very different needs than somebody who's already retired and may be very frail. And as you can see, we've now added, this slide didn't have the 110-year-olds, the super centenarians, who are growing in tremendous numbers in our community. And they are among the most unique of all the senior population. Studies all over the country and over the world right now trying to figure out how unique they are, why is it that they're living into these very old ages. We're also responsible for family caregivers. In the year 2000, the federal government added the Family Caregiver Support Act as a responsibility to area agencies, which said basically provide services and supports to families caring for somebody over the age of 60, and also assist older adults who are over the age of 60 providing care to kinship children under the age of 18, which is also, like in California, about 20% of all kinship care is provided by older people. So that's a major area that we're developing expertise, because we also have to understand children in order to provide support to those caregiving grandparents. Next. Demographically, Los Angeles is very unique. We have the largest concentrations of older people in the country, very diverse population. Actually, the diversity of the city of Los Angeles elderly population reflects what California would look like. In terms of elders, we have that right now. So we're actually experiencing what the rest of California will experience in 2030. We have a very large number of boomers. California is one of the top states in terms of the projections of growth in this population. As you can see in the region of Los Angeles, the county and city, we have 1.7 million older adults over the age of 60. That population alone is bigger than many states, and that's just our older adult population that we have to. So we do a lot of work that I will discuss in terms of working in partnership with the county. Next. I just identify a handful of trends for you. We're seeing a trend in healthcare from acute care to chronic care, because we're seeing as the population ages, it changes what it is that we have to do in the arena of healthcare. And we're seeing tremendous increases in the number of persons with diabetes that are experiencing some really adverse effects of that condition. We're looking at the prevalence of Alzheimer's. We're looking at things like arthritis and its implication across the spectrum of other health conditions. Caregiving, as I mentioned earlier, we're trying to define who are the caregivers, what are the impacts, for example, to the labor force in terms of persons who have to care for somebody else, and what is that costing industry when we provide no supports. One of the efforts of our department has actually been, we're doing a lot of exploration and working with large employers to provide programs at lunch, telephone conference calls that are actually educational conference, so people don't have to drive anywhere, and actually that becomes a barrier. If you're a caregiver and you work, when do you go to a workshop? And so we're creating things like a teleconference call where people can call in for like 30 minutes and actually get the information they need. Another area that we've spent probably the last 3 years working on with UCLA and with the Insight Center up in San Francisco has been around economic insecurity. One of the things that we're challenging is the federal poverty guidelines. They don't work. They're very antiquated, and they specifically don't work for older people. As you can see, the graphic shows that according to the federal poverty guideline, roughly about $11,000 should be enough for you to meet your basic needs. But in Los Angeles, for a single person who's a renter, you need almost $25,000 just to make ends meet. So when you look at Social Security and the income that most people get, which is about $900 a month, most seniors in the city of Los Angeles are behind every month when they start. So that becomes a tremendous challenge for us to look at and to begin to question. In California, the legislature actually passed a requirement that all area agencies on aging have to consider the Elder Economic Security Index as a planning instrument when we're looking at issues of poverty and social justice within older adults. I put some facts and figures around Alzheimer's. Alzheimer's is becoming one of the most expensive conditions that our country is seeing. I had the privilege of serving on the National Alzheimer's Advisory Body with the federal government, and really there's a race to try to figure out how we can abate the impact of this disease on our nation. We believe that delaying the onset on itself can be tremendously cost effective in terms of the costs that this really the drivers in healthcare right now are related to Alzheimer's disease. Next. There we go. One more. This is just to give you a sense, as I mentioned earlier. I work very closely with the County Department of Community and Senior Services, and now you'll see why. Through the wisdom of folks way before I came here, 2 federally designated area agencies were designated within the County of Los Angeles region. The City of Los Angeles, which is our Department of Aging, is one federally designated area agency. And then there's the County Department of Community and Senior Services, which is considered the county. They serve the 88 cities and unincorporated areas. And for many years, the 2 departments worked very independently and really rarely collaborate on anything. One of the things that I'm very, very personally proud of is the tremendous partnership that we now have built with our colleagues, and we're really making an honest effort to try to create seamlessness across our two departments, because at the end of the day, seniors and their families really should not be put through the extra barrier of trying to figure out that there's two of us. It's the only place in the country that this is the case. So it's very challenging for people to figure out on their own, so we try to do it for them. Next. Our city's aging network, I wanted to not only share with you what we do, but also to recognize that we have another city department that also works with seniors. Our service system is fairly robust. We manage about 162 unique programs across the city. Just to give you an example, our nutrition program is our largest program. We serve about 22,000 seniors a year. These are unique clients within our home-delivered meals and congregate meals program, serving over 1.5 million meals a year. That is a growing area of need in our community. Hunger continues to grow in the older adult population. As you can see, also our Department of Recreation and Parks is very involved in the social and recreational services to seniors. And so we work very collaboratively. Many of our congregate dining sites are located at senior centers. One of the things we're exploring right now with Rec and Parks is to see if we can decentralize some of our multi-purpose senior centers programs, our supportive services, and spread them a little bit more around our senior centers with the Rec and Parks Department. That's a work in progress right now. We think that it would increase our footprint in making our services more accessible to older persons. Next. This is just to show you, we're basically a grants-funded department. About 86% of all the money the Department of Aging manages is primarily through federal, state, and local grant sources. So I share that with you because that is a very limiting reality. While it's wonderful that we're very effective at having these resources on an ongoing basis, it also limits us. We have contracts of what we can and cannot do. And so to the degree that we have very little general fund, it limits our ability to be flexible and try new things because the grants don't allow for that. Next. Some of the core services, I just wanted to give you some examples. Like I said, our nutrition programs, our caregiver programs, elder abuse prevention. We're very involved in trying to address the vulnerability of some of the subpopulations within the elderly. We also have a very robust senior employment training program where we try to help older adults who are interested in returning into the labor force with job-ready skills in order to do that. We provide a lot of financial and benefits counseling, especially right now with healthcare. You're probably watching the television. Everybody's marketing Medicare because it's enrollment period. We actually have independent, unbiased advocates that counsel seniors on what may be the best choice for them. Our evidence-based health promotion programs are an area that we take great pride in, and it's one that is developing right now. Our ombudsman program, wanted to highlight, those are trained, certified advocates that go into nursing homes, board and care facilities to be the advocates of the seniors that live there. Most of those seniors have no visitors during the year. And so they're highly isolated, and these folks go in and they make sure that they're being taken care of well. Next. This is just to give you some understanding of some of the model programs that we've been involved in. Health preparedness is an area that we identified as a very important one for our population because we've been tracking recent studies and surveys that show that while a lot of older people are experiencing chronic care conditions, and more than one actually, on average two, very few of them are being told what to do to manage their care. And that's concerning because that means that people then go into hospitals, have to take more medications, and experience negative outcomes. So part of what we're trying to do is try to address that very directly by educating seniors about how to take control of their health. Next. For example, we have a partnership with Oasis Institute, which is out of St. Louis. They're very engaged in health education to seniors. And we actually developed a joint model program called Active Start. And as you can see, we had it evaluated by USC, and the professor that evaluated said it was remarkable. She'd never seen outcomes like this. Clients stayed in the program, even though it's 20 weeks. They stayed through it, they completed it, and they showed change that was very positive even 3 to 6 months later. So we're very proud of that intervention. It was actually replicated in several locations. Next. Thank you. This is one of our participants, Jacqueline. As you can see, she had knee surgery. When we met her, this targeted sedentary seniors, people who didn't move very much. And she actually started to go shopping after class, which for her was an incredible gain because she really had become homebound when she came to the program. Next. One of the things that we have been working with our community partners around is developing wellness center network in Los Angeles. All of our multipurpose centers have really embraced this work. As you can see, the partnership included LAUSD until recently, Partners in Care Foundation, all of our aging network providers. When we started, we actually had Kaiser Permanente was one of our partners. Right now, they've asked to take some time off. And also, UCLA was very involved with us. As you can see, over time, we've increased the number of completers, which is a very different measure than just participating. This means that they actually completed the entire course, whatever course they took. And we offer a variety of different types of interventions that we have found are very consistent with the needs of older adults. Our retention rates are very high, which we're very proud of. The federal government is looking at us as a national model. Next. That's just some of the classes taking place across the city. Next. Our Exit Gamers Wellness Program is actually something we did in partnership with Microsoft Corporation, St. Barnabas Senior Services, and Partners in Care Foundation. It was looking at off-the-shelf gaming technology, Microsoft Xbox. And we said, how can we use that to engage older people in moving and having fun? I call it the fun factor. Because, you know, nobody really wants to do boring exercise. People want to have fun. Older adults want to have fun, too. And what we discovered was that it works. People like bowling. People like Zumba dancing. People like break dancing and all these other things that they can do on the Xbox. It also is teaching them a technology that they can share generationally with younger members of their families. Most people don't think their grandma or grandpa is doing Xbox activities, but when they go home to visit, then they realize that they actually know how to do it. We've gotten a lot of attention. There was a partnership Microsoft also had with New York, and when they saw what they were doing with us, they actually demanded that they replicate this part of our program with them. So even New York City wanted to do what LA is doing.
Mr. How many more slides do you have?
Just a few, and I'll skip
You try to, because we want to have some time for questions.
Sure. We'll move fast. And Orlando's actually in the audience, and I welcome any of you to talk to him. He's one of our stars. Who has done incredibly well by really embracing these models. Next. Partnerships. In 2013, we launched the Los Angeles Alliance for Community Health and Aging with Public Health, with the county, us, and Partners in Care Foundation. We now have over 100 members that are helping us to disseminate these models. Next. We also have a very robust partnership with UCLA. We actually went after a federal grant designation to create a community-based academic partnership for research and aging, which has produced, as you can see, not only additional partnerships, but a lot of really meaningful research that we can use very applied in the community. Next. We also have a partnership with, led by the city and county area agencies with the 6 independent living centers, Department of Disability of the city. One of the things that we're very proud of is that we engaged 156 public libraries to serve as focal points for disseminating information about services to older adults and families. We also are working with 211, as you can see. Right now, we're fully engaged in working with the managed care plans in Los Angeles under the California Coordinated Care Initiative. That's very challenging. It's a very different environment that we've ever worked with, but we believe that we can bring value and they can bring value to improving the health of older adults in our community. Next. We also produce a television show in partnership with ITA. Next. Project CARE is a partnership with the Los Angeles Foundation on Aging, the department, the Detective Bureau of LAPD, and all city employees, and we're looking for folks to participate in Project CARE right now. So, all right. Next. We also do a senior art show in May, so hopefully all of you will see it when it comes up in the new year. That's a partnership with Los Angeles Foundation and the SCAN Foundation as well. In terms of the future, what are we preparing for? Mayor Garcetti has signed the Best Cities for Successful Aging Pledge. He has also, has instructed me to seek World Health Organization designation as an age-friendly city, which I will be talking to all the different council offices about. And he has also asked for us to convene a stakeholder process to develop a 5-year plan to stop hunger in Los Angeles for seniors. Next. In terms of recognition, just to show you, there's a lot to be proud of the work that our community does in terms of our partnerships with the Department of Aging staff, but also with the partners that we work with in the community, nonprofits that are contract with us. We have been recognized for that work, and we're very proud of continuing to raise the bar in the quality of services we provide to older people in this community. Thank you for the opportunity.
Thank you, Manager Trejo. We had a great hour-long discussion in my office. I encourage my colleagues to do the same. And before becoming the general manager, you worked for the LA County Department of Mental Health.
Yes, I did.
So, can you just one quick example before I open up questions for my colleagues is, can you give us an example of collaboration that you were telling me about? If a senior calls or walks in, and if it's something that you don't do but the county does, what do you do there?
We actually have our information and support staff work together very effectively. We can do warm handovers. If it's a call, we actually advocate on their behalf if we want to make sure the services are arranged. We work very closely. For example, Department of Mental Health has a mobile assessment and treatment team called Genesis that we work with very consistently because we want to make sure that the clients in our community are responded to.
So you call.
Oh, yes, we initiate.
That's great.
All the time. Because, again, we're trying to minimize the challenges that the consumers experience in accessing us.
So you don't give them just another number to call?
We try not to.
Okay, great. Colleagues, do you have any? Yeah.
Thank you, Mr. Chair. So, Laura, I think the Department of Aging is in such good hands with you at the helm. I've always thought that. And I think one of the best appointments the mayor ever made was you as GM of the Department of Aging. And I've had the great pleasure of working with you for years on countless projects. And I'm very excited because by working with Star Parsemian of my team here, we are about to open the Echo Park Senior Center.
Yes.
We cleared the last legal hurdle
Yes.
that LAUSD had, and we'll add a new senior center. Unfortunately, not in time for the holidays, but
soon.
shortly thereafter, because we're in business now officially. And that's a good thing. And thank you for your work on that and many other projects and improvements that you have made since being at the helm. It's exactly what we need right now. And as part of the baby boomer generation, the tail end of it, but still I'm a baby boom generation, I know that we're redefining what it means to get older in Los Angeles. And I'm so glad that you have a deep understanding of that because we're entering into uncharted territory.
We are.
But you kind of have a strong sense of where we're headed. So thanks for all your great work.
Thank
and I look forward to continuing to work with you. And we'll have a big celebration soon
Yes,
in
we
Echo
will.
Park.
Thank you for your leadership and support.
Thank you.
Thank you, Mr. Chair. I, too, want to join the choir and acknowledge you, Ms. Trejo, and your entire department and the work that you do. Oftentimes, you can do so much with limited funding. I'm happy to see that the department continues to apply for grants at all levels of government, and that's what it's going to take to keep this department afloat. I want to say 32 years ago, I remember my grandparents taking me to Anderson Senior Center as a kid growing up in San Pedro. Today, Anderson Park in San Pedro is still a senior center, which needs some more love. But I understand limited funding working with Department of Recreation and Parks. I'm happy to see the continued relationship and partnership with the Department of Recreation and Parks. I was at the Wilmington Senior Center just last week, and to see so many seniors come in through the doors that provide services and food was enlightening to experience that. My question was, as a police officer for 15 years now, as a reserve, as a senior lead, one of the crimes that came through my desk were crimes related to senior crimes, and I just was so frustrated to know that there's thugs out there taking advantage of our senior population. What are you doing today? What's the department doing today to prevent senior crimes and working collaboratively with the police department?
On two aspects. As you saw, we do elder abuse prevention. That's that's a base funding of our department. We work with WICE and Senior Services. They're the providers citywide. A lot of their work is to educate firsthand older adults about the types of scams that are occurring, that are emerging, and to remind them, this is still a different generation of older people. One of the things that we were working actually with the FBI on, we purchased these things called EC Hang-Up for them to install on the phones of seniors, because seniors have a hard time hanging up on predatory callers.
Right.
And so this is just a thing that you push a button when you don't want to say it, and it hangs up for you. And I actually bought 20,000 for the FBI in LA City to do that. It's low tech, but it works.
It works.
When somebody, because that was what the FBI agent identified to me. She said older adults will not hang up on the callers, no matter what I tell them. And so she started to buy them on her own. And one of the things we told her is, you don't have to do that. We can help you with that. And so that she could distribute them to the people that were being preyed upon. They actually have lists of people. With the LA City Police Department, we've been working in a partnership with patrol officers, for example, where we've developed business card size major phone numbers so that they can reach out to us. We've actually, in partnership with the Department of Health, developed a screening protocol to help law enforcement identify when elder abuse is occurring, but also when there's other limitations in terms of the senior, so that they can do a very rapid screen and get them connected to other resources.
Good. And who is our star guest with us today again? What's
We
his
have
name?
several.
Orlando.
Back
Please
there.
stand up and
Stand
be
up.
acknowledged. Thank you so much. We're proud of you. We love you. Thank you so much.
Thank you, Mr. Trejo. And, and the collaborative model that you're working with the county on is something that we want to replicate and throughout the city, because we want to leverage on our resources. So thank you so much.
Thank you.
We have a few speakers on this item. Could I get Nancy Volbert and Orlando Estrada to come on up? Mr. Orlando, do you want to go first? Our featured guest today? A minute?
It's a pleasure and an honor to be here. I had no idea that I was going to be one of the star performers, but actually the star performers, as far as I'm concerned, is the aging department. Okay, they've done so much for the senior center. Especially, I could speak for myself. I wasn't there. I had no idea that I was going to be pictured in there, and I'm grateful. Very kindly expressed myself. Of all the things that have happened, I've been in the senior center now for going on 7 years. I had a terrible time with my knees, but the exercise programs that are provided at the senior centers are just extremely important. There's Tai Chi, there's fall prevention programs, there's strengthening exercises. That helps all the seniors. If you take advantage of that, it's great. The other great thing is the lunch program. You get a fantastic lunch program for $2.
That's great.
Thank you.
Great. Thank you. Nancy, good seeing you.
Nice to see you too. Nancy Volpert with Jewish Family Service of Los Angeles. We are the oldest charity in Los Angeles and a multi-service provider. Among our efforts, we are very fortunate to be partners with the Department of Aging. We provide services at 2 multi-purpose centers as well as other senior services. And I wanted to thank the committee for bringing attention to this issue. It's something that, for those of you who have been on council a while, you have heard us in front of you saying, please remember the seniors, please remember the seniors. And bringing this attention is absolutely fantastic, particularly at this time of year. As Laura mentioned, they have a holiday program to reach out to isolated seniors. Our meals program would have been cut severely were it not for the support of the council 2 years ago and 4 years ago to reinvest where the federal government dropped out. And so we want to thank you and also thank Laura and James, our amazing partners. And we look forward to being partners with this committee in the future, bringing strength to the services. Thank you.
Thank you. Could I get Wanda Mcguire and Sherry Redford?
You have my card, sir?
Yes, I do.
She wants me to go first.
Good morning, I'm Sherry Revord, Senior Director of Strategic Communications for Partners in Care Foundation. As you heard from Laura's presentation, we are very closely partnered with the Department of Aging and with the county in the LACHA effort to spread the benefits of evidence-based health self-promotion programs. And I wanted to share a little story with you about that because it's really kind of touching. There's a Korean group of seniors that did an arthritis exercise program through the Department of Aging with us. And they loved it so much that when it ended, they paid out of their own pockets to have the teacher come and continue the class. And the last time we were there were like 60 people in this class exercising. And some of their feedback as a result were things like, we don't go to the doctor so much anymore, and none of us have been to the emergency room since we started doing this. So it really does work, and we look forward to working with you to protect and further this great educational work for seniors. Thank you.
Thank you, Sherry. And Sherry's also a Sherman Oaks resident.
I am.
Hi, my name is Wanda Mcguire, and I am a member. I reap the benefits of the St. Barnabas Senior Center Mid-City, and I actually started going there because I wasn't feeling that well, and I was having a lot of issues with chronic fatigue. And a friend of mine suggested that I go to the center and just see what they had available there, and I might find something. Anyways, when I went there, I initially started with the nutrition program, and I would just go to the lunch program every day for lunch, and I started to feel better. So I think that being able to get a nutritious hot meal for $2 was helpful for me. And after about a year or so, I started joining some of the programs there, which they have lots of programs, the exercise programs, the dance class programs, the card making program, the art program, and all of these things help to lift my mood and lift my spirit. And so I have benefited a lot from the programs myself, and I encourage many more seniors to attend the program. So it's been very helpful for me.
Thank you.
We look forward to working with you guys.
Thank you. Mr. Herman?
Wow, down to 1 fucking minute for all this. But fuck it, let's go.
Can you
I heard that.
Hold his time, please. Can you perhaps turn him off the air for our listening audience? Is that perhaps?
No,
Can we
you're
do
running
that
the
perhaps
clock.
for the? Hold his time, please. Can the city attorney advise on that?
I'm sorry.
Can you just turn him off the air because of the number of F-bombs that he's dropping in his...
I understand that he has the ability to say that, so I don't think you can turn
he
him
can say
off.
it in front of us.
It's not
but
unconstitutional,
off the-
sir. That's what she's saying. I'm going by the Brown Act. I'm going by my First Amendment right. My civil rights to speak as an American citizen. Can you start my time all over, please?
Start his time.
Since I was rudely fucking interrupted. Start my time. This is how fucked up it is. You don't give people the opportunity and you get us mad. You get me to excel and say, fuck you, Joe. 32 years of doing shit at Anderson Park. You're a bunch of phony bullshit. And 14% of FY funding from the city of LA by federal dollars? That's fucked up. We need more services for the elderly that are sick, elderly who are disabled, elderly who have AIDS, people who have AIDS, who are elderly. We need that kind of support, not the fucking ridicule of your bullshit 1 minute and interrupting my public time like Joe Blow. So stuff it. And that big ears Englander's running for county supervisor. Vote no for Englander, Mitch Englander, a big ears dumb bastard. Bye. He's not even in a seat.
Mr. Chair, I'd just like to say something. This might be a good example for our Health Commission to actually focus on mental health services because we have a few deranged people who show up and give public comment and they need medical attention.
And at the same time, the First Amendment right does not give you the license to be an idiot as well, for the record.
Thank you. That's, so item 1, we receive and file? Clerk? Oh, we're going to continue. Oh, so we'll keep it open, continue it, so they could come back and report to us at a later time. So item number 2, we're running really short on time, and item number 2 is very important. Mr. CLA, can you read that in?
Item number 2 is a verbal presentation by the city clerk on the outcome of the first meeting of the Los Angeles City Health Commission and its currently envisioned structure.
Thank you. And we have our city clerk, Holly Wolcott. And can we have our newly elected first vice president, Susie Shannon, and second vice president, Matthew Sharp, We have very limited time. I wish we had a little bit more time to talk about this, but we'll definitely bring you on at another committee meeting. It's to kick off the discussion today of our brand-new Health Commission, which hosted its first meeting last week. I look forward to working closely. This committee looks forward to working closely with you guys. To that end, Mrs. Woolcock, can you give us a quick overview on what happened at the first meeting?
Good morning, committee members. I'm Holly Walcott, City Clerk. I'm going to be very brief to allow the substance of this presentation to be handled by the esteemed commissioners that joined me this morning. Most of the first meeting was administrative, providing the oath of office, talking about what had occurred to bring us to this point, the election of officers, which we have 2 of them here today. We did adopt Robert Rules of Order and discussed that the regular meetings would be the second Monday of every month. And then also the city attorney did a presentation on the Brown Act. So the only other thing that we need before I turn it over to the commissioners is that we did discuss with them during the city clerk and CLA portion of the meeting is that they need to work with the CAO in order to for additional staffing needs. As of right now, they only have a commission executive assistant. But again, I want the substance to be not ignored, which is more important than what I have to say, so I'm going to go ahead and turn it over to First Vice President Susie Shannon.
Great, thank you. Thank you so much for asking us to come here today. So we've been tasked with assessing the healthcare needs of the residents for the city of LA and also to monitor how well the county of Los Angeles is meeting its obligations to the city. So I'm just going to deal with sort of the substantive issues of our future agenda items. Our next meeting is Monday, December 14th. We've asked Dr. Mitch Katz, who's the director of the Department of Health Services, to come and give a presentation to talk about the consolidation of health, mental health, and public health within the county, and more broadly sort of what they're doing, but also to talk specifically on the Housing to Health program, which is a program within the county that houses folks who are homeless. And they've housed 1,100 people so far, and they're only, the eligibility for that is just that someone visits, who is homeless, visits a county hospital or clinic twice within a year. And so we're sort of looking at that program. They've already housed 1,100 people who are homeless, a lot on Skid Row. We also have invited Dr. Cheyenne Roy, who's a medical doctor and administrator with County Harbor UCLA Hospital, and he's looking at the healthcare costs associated with homelessness, particularly within the county hospital environment and in terms of referring people out once they've been cared for within the county healthcare system. We've also been tasked with reviewing a sample of the health-related contracts between the city and the county, and so City Controller Ron Galprin will be giving a presentation, not necessarily at the next meeting, probably in January, on the contractual obligations that the county has to the city, so that we can start to monitor that and see if there's any need to change that or to see how well the county is meeting those obligations. And then also the City of Los Angeles Disability Department will be asking Stephen Simon, who's the director, and also the AIDS Health Coordinator to come and speak before the committee at some time in the future. At the next meeting, we've also put on the agenda a creation of our subcommittees. I'll be making a recommendation that we create one on homelessness and mental health, and the other commissioners obviously will be also making recommendations. And we'd love to hear, I think, from your committee as well, what would be most helpful for you in terms of looking at specific aspects of healthcare needs within the city of LA. And then we'll be looking at having presentations from the county for the My Health LA program, which is a no-cost primary health care and prescription drug program within the county, and then also looking at the plan for a healthy Los Angeles, which is our plan within the city, and making sure that we're looking at what the recommendations are within that, as I know that's sort of an ongoing program. And then our committee's work will culminate, I mean, I'm sure we'll be coming back to the council periodically over the course of the year, but our work will then culminate in an annual report, which should be ready a year from now. Thank you, and happy Thanksgiving.
Likewise. Thank you, Commissioner Shannon, for a thorough overview. My name is Matthew Sharp. Just a couple additional bullet points, so to speak. I have the privilege of serving in this process, been appointed by 13th Council District Councilmember O'Fala. I appreciate the opportunity to serve in this capacity. I've testified in this room on a semi-regular basis since the late 1990s in a number of different capacities with a number of organizations, and have the good fortune of working relationships with the leadership of all 3 county departments of health, which are now part of a large health agency, and have served on several task forces there. So I have some opportunity to bring a knowledge of these complex organizational structures to our process so that our framework can be mindful of the work that's in place, the policies that are in place, and the programs that can be strengthened. Just this past Friday, I had a chance to attend a briefing by the Director of Public Health of the county's Community Health Improvement Plan, which is their very detailed programmatic outline of how health will be improved for Angelenos over the duration of the next 5 years on the basis of a very thick and exhaustive community health needs assessment that was done. The City of Los Angeles is a core partner in these processes. So I share with you my optimism that we have a number of the tools at our disposal currently to effectively coordinate with the county to assess where progress is being made and where progress needs to be accelerated, particularly for the most disadvantaged neighborhoods and communities. Look forward to working with all of you to identify and act on the specific needs both from your communities that you serve as well as those of a citywide and countywide jurisdiction. So thanks for the opportunity and thanks for the partnership.
Thank you. And just to let my colleagues know, the president that was elected is our former colleague, Mr. Bill Rosenthal, who is the president of the commission. And Ms. Wolcott, I had a quick question. The AHF gave the city a grant of $100,000 to provide staffing for the commission. Is that correct?
Yes.
How is that currently being used, or how is it going to be used?
Currently, 40 grand of it, or approximately 40 grand, that's not the exact number, 43, something in that neighborhood, was provided to the city clerk this year for the commission executive assistant. So there's still a balance of 60 grand, which will likely fund that same position next year.
So it's a one-time grant?
It's a one-time grant at this point, yes.
And based on some of the goals and responsibilities that the first Vice President, Susie Shannon, outlined for the annual report and just basically basic staffing for the committee meetings, what do you think the staffing levels is required?
We haven't really discussed it yet. One of the next things that I'm going to talk to the committee members about putting on their next agenda is the staffing plan. The CAO has done 2 different reports on the subject, and we'd like to go over that with the commissions on what they think they would require. I know one of the staffing reports had 8 staffing members, but the council felt that that was too much. So we need to refine and work with the commission on what we think that they actually need. But we do think they need some additional support. They're going to need some research staff and some coordination staff.
Okay. And the commission, would they be reporting directly to the city council or to the Mental Health Education Committee?
The ordinance specifies report back to the council as a whole, is in the initial enacting ordinance.
Great.
Yeah, and I think it's basically Bill Rosendahl will report back to you, I think 2 times in the next year before the annual report. And that's basically to let you know where we are in the process in terms of creating that report. And then I think we might have some recommendations too for the council as we're moving along.
Well, I look forward to meeting with you guys separately. I want to open up to my colleagues for quick questions.
Sure. I know we probably have comment cards, and the time is late, so I'll save most of my questions for the next time. But thanks for volunteering. Thanks for stepping up to the plate. I think clearly there are deficits with what the county has to offer in terms of public health, and I think it's becoming increasingly more apparent that this is a commission that is needed for the City of Los Angeles, especially as it relates to homelessness and the complete lack of resources that the county is offering in terms of mental health services, especially in our homeless community. So I think that'll be a big area of focus and collaboration for what we do together. Thank you.
Great, thank you. And if you guys could give us written reports or whatnot, so I could share it with my colleagues. So we could, and if there's anything else that you guys want to come forth, we'll have more ample time to talk in different committees. Okay? Thank you so
Thank
much.
you.
Thank you.
And we have one speaker card. Mr. Herman, 1 minute.
What leads to chronic conditions of disability? Lack of resources, lack of intelligence, inability to understand that there is a chronic condition of no money that Joe Blow misunderstands about in order to help the homeless population on our streets. If you go to Joe Blow's area in Watts, you'll see that even the streets look as bad as his intelligence. So don't mess with the ignorance of Joe Blow Busquiano, nor vote no for Englander for county supervisor who can't provide us a deficit. I'm talking about a deficit. The deficit has to do with resources. Resources for homeless people on item number 2.
Interrupting the meeting.
No, I'm not. I'm on item number 2. So stop interrupting me.
And
The
disrupting the
city
meeting.
clerk,
And,
on the outcome of
make a
the first
notation that
meeting
he's
of the Los
disrupting Mr. Herman
Angeles,
is
every
disrupting
person speaking today was on the same topic I'm talking about, a deficit and a lack of resources. Morons.
Thank you. And no, there's no more speaking cards. So we will continue item 2 as well, so we could have them come back and report at a later day. For item number 3, seeing the time, if we could continue it to our next committee meeting. Item number 3.
Disrupting the meeting again. Mr. Herman.
City clerk and city attorney, if we could make another notation that Mr. Herman was to disrupt the meeting.
Yes.
So, just a second. Okay. So yes, so meeting is adjourned. Thank you.
Thank you, sir.